Hello, my name's Caitlin Brennan and I'm the founder and current president of Women in Surgery Scotland.
Hi, my name's Ellie Priestman. I'm a fourth year medical student at Bristol University. I'm also the ACIT Equality and Diversity Ambassadors co-chair, as well as being the vice president at the Bristol Women in Surgery Society.
Hi, I'm Michael Okocha. I'm a general surgery registrar in the Southwest and I'm the Association of Surgeons in Training Equality and Diversity Officer. I really hope you enjoy this episode of 50 Faces of Surgery. I hope that it leaves you feeling valued, inspired, and most importantly, welcome. Here I am.
Dr. Saskia Clark-Stewart is a CT1 based in Scotland with an interest in a career in general surgery. Graduating from the University of Edinburgh in 2017, where she also received an intercalated degree in reproductive biology, Clark-Stewart completed her foundation training in South East of Scotland Deanery. In 2020, Clark-Stewart completed the Edinburgh Surgical Sciences qualification whilst working alongside a research team in a cohort study of acute pancreatitis. Her passion for education led her to continue her teaching at the University of Edinburgh, where she was awarded Surgical Teacher of the Month 8 times for her dedication to the role. But her role as educator isn't limited to Edinburgh. As co-founder and education lead for Suture UK, she advocates for non-discriminatory provision of surgical education, supporting students to maximise their opportunities in surgical placements and encourages their exploration of surgical careers. So we'd like to thank you for coming today.
Yet, here you are.
So I'm just going to start you off with this interview by asking you, what's a typical morning like for you? What's your typical morning routine?
So I get out of bed after snoozing my alarm probably about 15 times, or certainly for 15 minutes. And I have a very mundane morning routine. I get myself ready, and it's all crucial on the caffeine intake that I've had that morning, how successful the day will be. So I start myself off with 1 cup, and I always make a second one for the morning handover. That's certainly the first thing it takes to get me awake and ready for the day. I'm currently working at the Western Isles Hospital, which is in Stornoway, so that is up in the Scottish Western Isles. And thankfully I've got a very short but sweet walk to work just over in the residency as I make my way up to the hospital. It's quite a small hospital, so the routine in work is the same every single day. We have a joint handover from the medical team and the small surgical team just to hear the night's activities and what's going on in the evening prior. And it's an incredibly friendly place. So morning handover is a very pleasant place to be. There's a lot of friendly faces, and that's certainly where I nurse my second coffee and get myself ready for the day ahead. It's like every surgical job, we have a ward round. We probably have a fraction of the patients that everyone else is used to, but that's just island life. But certainly we see a lot of different pathologies, so the ward round is certainly very interesting. And then if I'm lucky, it's followed by a day's case list, which thankfully, now that the pandemic has ceased for now, hopefully in the Western Isles, we're now back to elective operating. So I'm thankful that we've got some more work. And that's pretty much morning routine.
That sounds pretty standard, I would say, the caffeine to survive the morning.
Mm-hmm. Very necessary. Mm-hmm.
Mm-hmm. Another question that's quite interesting is, where did you grow up?
So I grew up, I've travelled quite a lot, travelled over quite a lot of Scotland so far with my training, but I grew up in a small town called Gourock, which for those of you that are not familiar with Scotland, that is a small coastal town in the West Coast. So I'm somewhat at home being over in the Western Isles, but certainly the weather is even worse up here than it is in the West Coast on the mainland. So Gourock's a small town. Their population is about 10,000. I didn't know that, I Googled it, just to give you an idea of the size of it. It's a lovely small town, which was a great town to grow up in. And my family, both my parents grew up in Gourock, and there's not very much there. So you have to use the kind of sister towns that are nearby in order to function and get everything that you need for daily living. But it was a nice, safe, happy place to grow up, I definitely think.
That sounds really lovely. And you've already touched on what it was like growing up there, but could you go into a bit more detail on just exactly how you kind of grew up and what it was like for you?
Sure. So I was first born to my parents, Tony and Jennifer. I then had my sister who followed, who was 4 years younger, and it's the four of us that have been our family unit. Growing up was very simple, very happy. It's been quite nice looking at the questions that were coming to reflect on what childhood was like. But yeah, I would simply say it was a very happy time. Everything was quite easy, and whilst I guess we weren't always in a great financial position, I think a lot of people can understand that and have been through similar. But I think as a child, I certainly felt like every door was open. I never felt that there was anything I was without. That's entirely down to my parents and the upbringing that they were able to provide. But I never felt like there was something out with my reach, something I couldn't achieve, even from a young age, which I think is quite an incredible thing for a child to be able to feel.
What made you apply for medicine in the end?
My application to medical school was incredibly well calculated. Some people have their careers lessons in 5th or 6th year of school, certainly Scottish system, and they'll think, oh, actually, I've got the grades, I might apply to medicine. For me, this was a multifaceted endeavour, and I think I'd been preparing for this from about the age of 10, and that's no word of a lie. I do remember having quite a short but productive conversation with my dad, and I should say that there's not really medicine in the family currently, but my grandfather, my maternal grandfather, had been a GP. He sadly passed very early in his career at the age of about 35, but medicine was in the family in some way. So it was something I'd been aware of, and I certainly had met a lot of doctors by the age of 10. So I knew what they did and what their career what it was there for. But this conversation I had with my dad was quite short, and I think I'd asked, I just moved from a private school to a state school at that time, and I think I was realising that my education was changing slightly and I wasn't being stretched in the way that I was used to being stretched. And I think, being conscientious at that time, I was a bit concerned about that in my 10-year-old life. And I'd said to Dad, right, what's the end goal here? Like, I'm in this new school and I will be going to high school after that, and what am I striving to do? And I think my dad might be a bit taken aback by that question. He answered, well, you could try and get 6 straight A's for a start. And I thought, wow, okay, that sounds good. That sounds like a real achievement. And yeah, that really for me was an end goal. And I thought, right, well, okay, what do I then do with those 6 straight A's? What's a good career to do? And I should say, my dad's not medical. He's clever. He's not medical. But he had said, well, I think he'd mentioned a couple of careers. I think he mentioned lawyer, and I think he mentioned doctor. And I thought, well, I have my younger sister who outwits me with every argument we ever have, so I don't think lawyer will be a very lasting career for me. But something about doctor just encapsulated a few values I thought that were important to me at the time of being 10.
And we mentioned in the introduction that you attended Edinburgh University for Medicine. What was it like?
I think we all enjoy medical school, and it was thankfully everything and more that I could have hoped. I had a few options in terms of where I went. I had the offer from Edinburgh, for whatever reason, had always been in my head that this is the one that you're going to go for. There was something about the city of Edinburgh that I just loved. I hadn't been there until the post-offer open day, and I remember thinking, wow, you could really be at home here. Yes, it's a big city, it's the capital city, but it's almost like a big town. So it didn't feel like too much of a jump from home, even though it was a big move. At the time, I went through my first year and second year, largely lecture-based. And then I just loved all the different opportunities that were available to you. You had so many societies. I remember the day that I confirmed my application and confirmed my offer. And the first thing I went to do was look at the websites for the various societies. And I thought, brilliant, all these extracurriculars that I do, I can keep them up. Never that I would have the time to do that, but certainly I kept up dancing, I kept up with playing music and all sorts of different things, in sport, netball, what have you. So I just felt like the opportunities were endless and had a very happy time at university. yes, there's a lot of distractions, and I think looking back, I might have told myself, like, okay, knuckle down a bit harder and maybe work a bit harder for a longer period of time and don't cram so much. That might have been what I would say back to my university self. But yeah, it was a great city to be studying in. It felt very safe. And I, at every stage, had lovely friends around me, all great tutors, great registrars and consultants that would teach me. I certainly felt inspired at all times, and I was never bored at all. So.
And you mentioned your training's taken you to quite a few places so far. Where have you been, and how has each hospital differed?
So I think that was a good thing about being in Edinburgh. There was a number of different hospitals that you could be placed at. And once I got in, I obviously intercalated in my third year, and then was quite desperate to get back into clinical years. So when I went to my fourth, fifth and sixth year, I was lucky to have a lot of peripheral placements. Of course, there's the Royal Infirmary in Edinburgh, where I worked as a foundation doctor and beyond, and the Western General as well. But I found my first placements in Kirkcaldy, that's a hospital in Fife, the Victoria Hospital. That's where I think that's actually where I first found my interest in education in medicine. So for those, some will probably been in Kirkcaldy Hospital for placements, but it was such an interest in your learning, even as a medical student. So I think I first went there as a fourth year, and there was just such an interest in my experience of medicine and my placement, which I hadn't quite encountered before. And having done both general surgery and general medicine there as a final year student, I thought, what better place to be as a new foundation doctor? Everyone says just how stressful it is, and everyone will have their different things that they want out of their foundation year. I wanted to be fairly close to home for family support. I knew that it was going to be difficult. I wanted somewhere that I knew, so I knew Kirkcaldy Hospital inside out. I knew the general surgical team, I knew the medical team, and that's exactly what I did. So for the first 8 months, I was there doing general surgery and general medicine. I'd always enjoyed my surgical placements, even as a medical student. I did toy with the idea of medicine through a few of my other FY jobs, but it always came back to surgery. And once I'd done my stint in Kirkcaldy, I went back to Edinburgh. And that's where I absolutely firmed my want to do surgery. I worked in general surgery as an FY2 in the Royal Infirmary in Edinburgh. And that's predominantly upper GI and hepatobiliary surgery there, and I loved it. I just loved the buzz of on call. I loved the team working. I loved the pace of the work and the pathologies as well. So, and especially time in theatre. So those jobs, I think, definitely shaped me to where I am just now and all of my interests that I have.
And you're now in your first year as a core trainee. What was your first week like in that job role, and maybe what was your first on call like, perhaps?
So I think my first week and then first on call, slightly different experiences, for the reason that actually my CT1 in Rigmore, in the Rigmore Hospital in Inverness, that's where my first job took me, was actually a supernumerary role, which isn't always the common denominator. And I mean, it's a great team up in Inverness, and I was really keen to get up there and really see some general surgery without having sites split. So I had both access to upper GI, colorectal, vascular, and really anything else that came in the door beyond 5 o'clock. So my first week was very pleasant. I felt very ready for the role. I had a lovely team who were friendly from the minute go, and I felt very at home, and I felt that I could speak to my registrar colleagues and consultant colleagues with ease and take any concerns I had to them. So the first week was probably one of the easier weeks that any of my colleagues might have had, but very pleasant. And I quickly got into the runnings of the hospital, understood how the systems worked, how to take a patient and book a patient for theatre, all of the logistical things that make that first few weeks difficult. My first week on call, I did feel quite ready for this actually, but wasn't quite prepared to be handed the registrar bleep on maybe day 2. So my on-calls were shared with the registrar. And again, it was brilliant, because what an opportunity for training, in that you're there with your registrar. I mean, I'll shout her out. Jen Pollard was who I did my first week with, and several other on-calls. And what a trainer. I mean, I just felt so supported, so safe in that even though I was doing some things independently, I felt that Jen was there, she was happy with my decisions, and we talked things through. So again, it was an on-call, it was busy, but I didn't feel that help was far away, and I felt very supported in what I was doing. I wasn't finding myself in the middle of the night holding the bleep, not able to get hold of anyone, not any of the horror stories you sometimes hear. So it's definitely been a very privileged start that I've had.
Going on from that, what challenges have you faced along your journey?
Mulling this one over, and I think the whole initiative, 50 Faces of Surgery, is really an important topic, and I think I'll share the things that I was pondering over. Everyone's had their challenges, and I think that's a really important thing to always remember. It's not just the work and the people you come across, and there's so much more to it. It's not just the day you're having. Whilst I say I had a lovely childhood, I did, and it was simple most of the time. I did say that I've come in contact with several doctors by the age of 10. So I was actually diagnosed with what was called at the time juvenile rheumatoid arthritis when I was 4 years old, affecting multiple joints, predominantly my right wrist and my right knee. For me as a young girl, I can't say that I would want my life to have panned out any differently. Adversity happens to all of us. Yes, having a chronic condition is a tricky thing at times, but as I explained to you, I've had a very happy and reasonably simple upbringing. In terms of overcoming that, I think there's been multiple times in my life where that's posed a challenge, a lot of the time because it's an invisible thing that a lot of people aren't aware of until you open up about it. And I've always been pretty open about it as well, because I think if you're not open about it, then no one will be. And then how do we get through things together, and how do we help each other through various challenges? In terms of this diagnosis, yes, it probably was what put me into medicine in the first case. I saw what doctors did, and I saw the positive impact they can have on not just me as a child, but on my family. So for that reason alone, I would of course go back and change it for my parents, because I know what it's been, I can only see what it's been like for them. But I think that really gave me a nudge towards medicine as a career. And I think it's taught me lessons really in resilience, which I think is a very important thing in, especially looking at a career in surgery, but medicine in general. I think it's really made me quite capable. So I really don't see problems with things. I try and see solutions. And I think having gone through a life of problem solving and maybe doing things slightly differently, it kind of has instilled in me a great problem solving ability, and that I don't often see things as challenges, but maybe stretching me, or maybe having to make a bit more planning around something to get the end result. But also I think, whilst I say it's helped me be capable, it's helped me be resilient, it's made me quite empathetic. So I've gone the circle of patient to doctor, and it's brilliant to say, yes, it's possible. And I know there'll be a number of doctors in a similar position as well. So I think that's something to be celebrated. And it's probably the biggest adversity that I've suffered so far. Thankfully, it's with disease at pretty quiescent now in adult life. It's something that's there, it's something to be remembered and acknowledged, but it shouldn't hold you back. And I have never once let this hold me back. So.
And you co-founded Suture UK, which is trying to challenge the way that we do teaching. Could you tell us why you founded that? So
this is something I'm hugely passionate about, and really it began when I was doing my FY3 year, which was it was really an academic year. So it's called the Anatomy Research Fellow at Edinburgh University. I had always been passionate about anatomy and teaching, and thought that it was the perfect FY3 for me. So I started that and quickly found that I was, the medical students were my new cohort, and I was spending more time with them than I was anybody else. And it was really, they're a great bunch. It was all different years. And I found that there was a number of opportunities came from that. So the first thing that I saw was that I name dropped them. It was the Edinburgh Surgical Society, which has a terrific society full of really enthusiastic members, and I'm sure terrific surgeons for the future. they were running their surgical skills club. And this is something that I think they had started that year, back in the September. And you know, I went along and I emailed them actually. I sent them a message and said, I'm not a trainee yet, but I can do some stitching and I can tie some knots. If you want a spare pair of hands, I'm more than happy to come along. Almost kind of downplaying the fact that I wasn't yet a trainee and that maybe I didn't have that much to teach them, but I was happy to help. I was actually met with a really welcoming response, because they said, you know, actually, we're struggling to get trainees to come and help us. So any teaching you can give us, we're delighted to have. And I then followed it up with, brilliant, I'll come along. And what are you following a curriculum? Are you following any sort of schedule with teaching, or is it just ad hoc? And the answer at the time was, oh, we're just doing ad hoc. And I know that's a very common thing with surgical skills societies throughout the UK. So I went along thinking ad hoc is fine, but I quite like to teach a topic and then have some sort of assessment feedback and then progressing. So I've always kind of liked that method of teaching, and it's really important for surgical training. So I thought, I wonder how I can instill this with the students. So they had at the time a skills coordinator, Shiv Kenny, who is my co-founder for Suture UK and chairperson. And we sat down, and again, Michael Poon, who's also one of our advisors for Suture UK, the three of us actually came up with a curriculum, very simple, basic surgical skills that we wanted the students of Edinburgh Student Surgical Society to achieve. And we had drawn up some educational materials for them, predominantly some kind of picture text, instructional sheets of how to do it. I would give them, and Michael would give them, some teaching during the sessions. And then we also put together some basic assessment and feedback sheets that they could complete, almost in the form of worksheets. This was back when face-to-face teaching was a thing. We then had planned an assessment day, and that was going to be a biannual day where the students could come and be assessed by trainers, trainees, any grade, but we were trying to aim for those who had done their basic surgical skills course to then allow the students to perform any tasks that they wanted to perform for some assessment and feedback, and they could put that together in a little skills portfolio that we were trying to build at the time. Unfortunately, COVID hit and we couldn't do our assessment days as we planned. And I think this was a good thing in a way for the Suture UK group, because it forced us to very quickly span out, and rapidly we became a national group and collaborative where we have now about 27 or 28 members on our steering committee. It has grown arms and legs, which I'm delighted about. What we're aiming to do is broaden access to surgical skill, good quality surgical skills training, recognising that these good habits should start early. And why should students have to fork out fortunes to attend skills courses? We're not trying to replace them. I think I've been to them myself. I think they're great, really important, and a great opportunity. But practice, we often attend these courses and then don't pick up tools till the next time. And that is so important. Practice and practicing well and good technique is so essential. So we're trying to reduce the barriers to practicing surgical skills. We're working predominantly through the surgical societies to give them the tools they need to teach good quality surgical skills with the oversight of trainers, which can be anyone from the core trainees upwards, or anyone who's done their basic surgical skills course. So as I say, it has really taken off. We've got a curriculum of 12 basic skills to perform with accompanying learning resources, so educational sheets. We have assessments for the trainees in order to assess and feedback to the students, and an online platform for them to record their activity and their attempts. So hopefully over time they can see their progression and be encouraged by that, trying to instill the importance of practice and not just doing a skill once or twice. I could talk forever about Suture UK, so I felt that was a natural point to stop, but I'm happy to answer any other questions if you've got them.
Yet, here you are.
If you could go back in time, what would you say to yourself to give yourself some motivation or inspiration as a young woman?
I think it's a great question, and I've thought long and hard about this. And Do you know, I think my younger self knew exactly what she was doing. She was thankfully very supported by family, friends, teachers, guidance. And I think I would just say to myself, trust the process, because you'll get there. It's worth it in the end. It's worth every hour of work that you're putting in. You do get out of life what you put in. So I would just say trust the process.